new parents, especially mothers, can experience intrusive thoughts about harming their baby, despite having no intention to do so. If you or someone you know is pregnant, it's better to be aware of this information. Hi there, it's Autumn. In today's video, I'm going to share some OCD facts that you may or may not find unusual or even a little bit scary. But here is one fact I'll tell you right away. OCD is a very treatable disorder. So, don't worry if some of these facts sound a little bit concerning. Remember, OCD is highly treatable. Let's do it with bullet points. So, number 1. OCD is not about being neat. One of the most common and harmful misconceptions about OCD is that it is just about cleanliness. Lots of people assume that OCD is all about being organized and clean. But many people with OCD have intrusive thoughts about harm, religion, or even taboo topics unrelated to cleanliness. And a very dirty room. At least messy. Shout out to Alaska. Number 2. OCD is ranked among the top 10 most debilitating illnesses by the World Health Organization when measuring the loss of quality of life and productivity. So claiming that all it is about is cleanliness is an understatement at least. Number 3. Intrusive thoughts can be widely disturbing. People with OCD experience intense, unwanted thoughts that are often the complete opposite of their values. These thoughts can be violent, sexual, or downright bizarre, causing them extreme distress. It's very important to note that these thoughts are intrusive and unwanted. They do not reflect the individual's true desires or intentions. Hi there, it's Autumn. This channel is new and creating this content takes courage and bravery. It means a lot to us if you subscribe to the alternative OCD room. Wishing you all the best and bless you. Number 4. It's not all rituals. Mental compulsions are real. Some forms of OCD, often called pure O, involve mostly mental rituals and compulsions, such as excessive mental reviewing. Many people with OCD perform invisible mental rituals, like counting, repeating phrases, or seeking reassurance internally. Sadly, this makes their suffering harder to spot but not less intense. Number 5. People can spend hours on a single compulsion. A person with OCD might spend hours repeating the same task, like checking logs, washing their hands, or mentally counting. Some have even described being stuck in rituals for entire nights. Number 6. Magical thinking is a common OCD symptom. Magical thinking OCD makes people believe that certain actions, words, or numbers can prevent terrible things from happening. For example, they might believe that tapping a surface a specific number of times will keep their loved ones safe. Number 7. OCD can affect memory and concentration. Because people with OCD are hyper-focused on rituals or intrusive thoughts, it can create a sense of false memory or poor concentration, leaving them unsure of things they have done or not done. So, I locked the door or no? What if I didn't? What if I left something dangerous plugged in? Number 8. OCD is not always recognized by the people who have it. Many individuals with OCD don't realize their symptoms are part of a mental health condition, which can lead to years of suffering without treatment, just like Alaska. Number 9. OCD is often misdiagnosed. It can take 7 to 10 years on average for someone with OCD to get a correct diagnosis. Many people are mistakenly treated for generalized anxiety or depression, without addressing the compulsions driving the distress. Number 10. OCD affects 1 in 40 adults. It's more common than people think, yet it remains highly misunderstood and stigmatized. Despite its prevalence, OCD often hides in plain sight due to embarrassment or fear of judgment. So please, let's be kind. Number 11. Compulsions may seem random, but they feel urgent. Compulsions seem completely unrelated to Some compulsions seem completely unrelated to the fear, For example, flipping light switches to prevent a loved one's death. And you could say, oh, that's totally irrational, that doesn't make sense. Yes, and that is the thing. It is irrational because it is a mental illness. But the connection feels very real and necessary for someone with OCD. If you have OCD, I'm not suggesting that you should perform compulsions just because your fear feels real. Instead, I want to help us understand how it is like for you, so we all can be more educated, compassionate, just better human beings. Number 12. OCD shares genetic links with other disorders. Studies show that OCD shares genetic risk factors with other conditions like autism spectrum disorder. Both involve repetitive behaviors and difficulty shifting focus. Tourette's syndrome. Many people with OCD also experience tics, anorexia nervosa. Perfectionism and obsessive behaviors are common traits. Number 13. Postpartum OCD is more common than realized. New parents, especially mothers, can experience intrusive thoughts about harming their baby, despite having no intention to do so. If you or someone you know is pregnant, it's better to be aware of this information, because if you know, you can get treatment earlier. This form of OCD is highly distressing, but driven by fear, not by desire. Number 14. OCD is a brain circuit disorder. Research shows that OCD involves dysfunction in the brain corticostriato-thalamocortical circuit, which regulates decision-making and emotional responses. This contributes to repetitive, intrusive thoughts and compulsive behaviors. Number 15. There is a link between OCD and synesthesia. Synesthesia is when senses cross over, like seeing colors with numbers. Some research suggests people with OCD might be more likely to experience this phenomenon because of their enhanced sensory awareness. Number 16. There is a subtype called sensory motor OCD. In this form, people become hyper-aware of automatic bodily functions, like blinking, swallowing, or breathing. Once noticed, they obsess over these actions, feeling trapped by their awareness. Number 17. OCD is often confused with OCPD, Obsessive-Compulsive Disorder. What we are talking about involves distressing obsessions and compulsions driven by anxiety. Obsessive-Compulsive Personality Disorder is about perfectionism and control, without unwanted intrusive thoughts. Many people mistakenly use them interchangeably, but they are fundamentally different. To be honest, I had this misconception as well. Number 18. OCD and sleep problems. OCD frequently coexists with insomnia. People with OCD might stay awake performing rituals or ruminating over their thoughts, causing sleep deprivation that worsens symptoms. Number 19. OCD is linked to pandas in children. Pandas can cause sudden, severe OCD symptoms in children following a strep infection. Number 20. False reassurance fits the obsessions. Reassurance might seem helpful, but for someone with OCD, it can make the obsessions even stronger, reinforcing the need to ask again and again. Number 21. Last but not least, OCD can affect language use. People with OCD sometimes avoid specific words or phrases they associate with bad luck or negative outcomes. This can result in refusing to say words like death or failure, to avoid bringing those events into reality, using alternate phrases or euphemisms as a form of mental compulsion. That's our video about some OCD facts we have found. And remember, if any of these facts are stressing you, they shouldn't. OCD is a very treatable disorder. There is always more to learn. And who knows, even new discoveries about OCD could surprise us all in the near future. In the meantime, take care of yourself, be kind, and keep spreading love. Don't forget to subscribe, and I'll see you next time.